Brendan is running on a treadmill at 10 kilometres per hour. He's exercising the muscles of his legs, but he's also exercising some much more important muscles, the muscles of his heart. Here's the human heart beating, the dark pulsating blob in the middle of the screen seen by X-rays. And here's an actual animal heart, a rabbit's, a bag of muscle contracting and relaxing to make the heart beat. It's kept beating artificially in the laboratory using oxygen, and a special fluid pumped to it at exactly the right body temperature. Brendan and Christine are having their heartbeats monitored so that you can see and hear them. That's Christine's at the top, and Brendan's is at the bottom. You can see that both their hearts are beating quite slowly because they're both sitting doing nothing. Now Christine's still resting, but Brendan's on the treadmill, running at 10 kilometres per hour. His heart has to work faster than hers, pumping more blood around his body to provide his muscles with fuel and oxygen. Listen to her heart, still slow at the top. And his faster at the bottom there. Now Brendan's resting, and Christine's running. Her heart now beats faster. See it at the top? While his is slow again, because he's not doing anything strenuous. When you exercise your body, you exercise your heart muscles and make them stronger. And you also develop other important organs as well, your lungs. For the next 2 minutes, Brendan's going to run again, and we'll see how much air he has to pump through his lungs in that time to supply the oxygen his body will need. The air which passes into and then out of his lungs is collecting in this big plastic bag. Listen to the valves opening and shutting in his face mask as he breathes air in and out. Two minutes, and the bag's full. Running for 2 minutes at 10 kph meant that his lungs had to deal with all this gas, over 100 litres of it. Here's another way of showing what the lungs have to cope with. When he's just standing there, Brendan needs only a small air supply. You can see each little breath registering on the dial. And his heart rate, quite slow. Now he's running again at 10 kph. Watch the dial. He's taking in bigger gasps of air, which he needs to keep him going, and he's keeping his lungs fit. And exercising his heart as well. Now, let's make him work harder. We tilt the treadmill so that he's running slightly uphill. Greater effort means that he needs even more air, and his lungs have to work even harder. His heart, as well, must pump blood around more rapidly. We make the hill even steeper. Now see what great gulps of air his lungs are taking in and pumping out again at every breath. This really develops the lungs. And it develops his heart muscles. Exercise makes you fitter and stronger because it makes your heart and lungs fitter and stronger. Let's take a look at the human heart and lungs. The lungs are those big bags at each side, and the heart's there in the middle. Do you see those blood vessels across the surface of the heart? They're the coronary arteries which supply the heart muscles with fuel and oxygen. If we take the heart away, leaving only the blood vessels, you can see the network of arteries which delivers blood to the heart muscles. When people eat too much of the wrong food and smoke and don't take proper exercise, the arteries thicken and get blocked, and then the heart may stop. It's like a motor car engine. Imagine the engine's your heart. It's supplied by this pipe, which is equivalent to a coronary artery. If this gets blocked, we'll do it just by squeezing the pipe. The engine stops. The muscles can't work. There's no fuel for them. Our coronary arteries are the supply pipes for the heart. Block them, and the heart stops. You have a coronary, a heart attack. This is what can happen to you if you don't get enough exercise, if you get overweight, if you smoke cigarettes. This chap's overweight. He doesn't usually exercise like this. Let's listen to his heart rate and compare it with Brendan's, who's much fitter. The overweight first. Now Brendan. His heart doesn't have to work nearly so hard. The fat chap again. An unfit heart has very little in reserve, and at the same time the coronaries may be thickening. If you're overweight, you're more likely to have a serious heart attack. You might die. Smoking increases the risk of heart disease. That's one of the ways in which cigarettes can kill you. It also damages your lungs. Let's look again at the human lung. Inside each lung, there's an intricate, lacy network of fine air vessels. Just look at them all. Tobacco smoke damages these delicate vessels, makes your lungs less efficient, makes you less fit. Smoking also introduces a poison gas into your lungs, and so into your blood. After this girl's finished her cigarette, we'll analyse the gases in her lungs, looking for the carbon monoxide which comes in tobacco smoke.
15, 16, 17, 18, 19, blow. it on the... switch the thing on.
In a few moments, the needle will show how much carbon monoxide had got into her bloodstream from her lungs.
There we go. This is the carbon monoxide that was in your blood that you've given off into your lungs when you held your breath. It's going up towards 35 parts per million. It should probably go up to about 40 parts per million, which would indicate that roughly about 10% of your blood is inactivated by the carbon monoxide.
Carbon monoxide is the dangerous gas that comes out of motor car exhausts. It gets into your blood so that you don't get as much oxygen from your lungs as you should when you smoke. But there are even deadlier chemicals in tobacco smoke. In the tar which you inhale from a cigarette. 20 cigarettes put this much tar into your lungs. Substances in this tar make you addicted, so that it's very hard to give up smoking, and at the same time your lungs get damaged. We visited this hospital to find out what smoking does to your lungs. We talked to a specialist, a radiologist. Here he is, x-raying a patient.
Right, now we're going to have a look at your heart. In fact, you can see it yourself if you look up in the monitor there. You can see it beating away. Right. Now take some big deep breath in and right out. That's fine. Now in again and out. That's the idea. And ribs going up and down. And also a little further. Now you can see your diaphragm going up and down. When you breathe in, there it goes down. Breathe out, and there it goes out. Another deep one, in and out. That's fine.
That man's heart and lungs were healthy, but radiologists see a lot of smokers whose lungs are definitely not all right.
We know that patients who smoke heavily and have smoked regularly do develop certain diseases much more frequently than people who don't smoke and have never smoked. In particular, of course, this is lung cancer, chronic bronchitis, certain forms of stomach disease like duodenal ulcers, and certain forms of heart disease. The other interesting point is that we are now seeing more women patients with lung cancer than we ever did before. And the reason for this, we think, is because women have only smoked regularly and heavily since about the 1940s onward. And now is the time when the result of their smoking is becoming evident. Now, here is a normal chest X-ray. The lungs are shown black on either side of the picture here. They're full of air. Here is the spine running down the center. On either side is a collarbone. The ribs are shown on both sides, of course. And right in the center is the heart. This is the outline of the heart, and immediately below, right across, like this, is the diaphragm. Below, of course, are the various organs in the abdomen, which we can't see on this film. Now, if we go to this chest X-ray, I think you can all see that there is something radically different from the one we've just been looking at. And the answer, I'm sure, many of you will have spotted already, is that there is a round mass, rather like a cricket ball, in this side of the lung. And if you look at a side view up here, you can see it even more clearly. And this, I'm sorry to say, is a lung cancer. And when I tell you that at the moment in England, Wales, Scotland and Ireland, there are roughly 100 people dying every day from lung cancer, you will see that it's an immense problem. And that is the X-ray of a man who was a heavy smoker. In this hospital alone, my colleagues and I see about 10 patients a week with lung cancer, and most of them, if not all of them, are heavy smokers. But it's not only lung cancer. I mentioned chronic bronchitis. And here is a man, I need hardly add a heavy smoker, with chronic bronchitis. And you'll see what a nice clear lung this normal one is, and here streaky, darker, and these are the indications of chronic bronchitis.
Bronchitis, so you can't breathe properly, and cancer, which can kill. We asked him about the risks run by people who start smoking young, when they're still at school.
I have myself seen patients in their 20s with lung cancer, and these are people who've perhaps started smoking heavily at the age of 11 or 12, and 15 or 20 years later have developed a lung cancer. At the moment, the main line of attack is by surgery, and there are people who've had their lung cancers removed, part of the lung as well, of course, or even a whole lung, and they do very well for years to come. But the prospects are not bright, and it is clearly much better to take preventive measures than it is to try and cure it, which is extremely difficult.
So here are your facts for life. Take plenty of exercise. Find out what sports you like and enjoy them. Your heart will get stronger. Your lungs will stay healthy. You'll be fitter, feel fitter. You'll be able to enjoy yourself more. Most important of all, if you don't smoke already, don't start. If you do smoke, well, it's hard to give up and you're in real trouble.
You can make a contribution to the last two programmes in this series by sending in questions or comments from your school. Details are given on page 27 of the Facts for Life Teachers booklet. Please send your questions as soon as possible.